Welcome to the Learning Pines YouTube. We hope this video helps.
You start by confirming the exact Captopril dose and schedule prescribed to you. This prevents errors. Once you have the bottle, read the label and check for allergies or pregnancy warnings. Make sure your blood pressure and heart rate baseline are noted so you can compare effects. Take the tablet with a full glass of water. Do not crush unless instructed. If instructed to take with food or on an empty stomach, follow that timing carefully to keep absorption consistent. You should swallow the Captopril tablet whole with about 120 to 240 milliliters of water. Avoid chewing to maintain correct release. Take it at the same time each day to steady blood levels and record the time in a log. After the first dose or dose change, monitor your blood pressure and symptoms for at least 2 hours because lightheadedness or dizziness can appear. If you feel faint, sit or lie down immediately and measure BP. Contact your clinician if severe. For ongoing use, make sure you refill before your supply runs out and maintain the same dosing schedule. If you miss a dose and it has been less than 2 hours, take it. Otherwise, skip and resume the usual schedule. Do not double dose. Monitor for persistent cough, facial swelling, or severe lightheadedness because these require prompt medical attention. If you experience troublesome side effects, stop the medication only when advised. Instead, call your prescriber to get tailored next steps.
Thanks for watching. Consider subscribing if we helped you.